Okay, so I'm here with Anna and Liz at Four Pines Physical Therapy, and we're going to be talking today about plantar fasciitis. And they'll get more into the details about it and introduce themselves, and hope you guys enjoy. So Liz or Anna, go for it.
I'm Anna. I'm a PT here at Four Pines. I've been here for about 2 years.
I'm Liz. I'm also a PT here at Four Pines, and I've been here since December.
Perfect. Okay, so first we'll start with you, Liz. What is it?
We have a connective tissue on the bottom of our foot that helps support our arch. It's called our plantar fascia. And then when that becomes inflamed, itis means inflammation. So when that becomes inflamed, that is plantar fasciitis. And we're going to talk about different reasons why it can become inflamed and what you can do to help with that.
Perfect. Great. So then who does plantar fasciitis affect really?
So yeah, plantar fasciitis can really affect anyone. Some of the things that cause it, so what it is, so plantar fasciitis, your plantar fascia gets put on tension when you're weight bearing. So if you're weight bearing and you have a kind of incorrect walk, or you're wearing shoes that aren't very supportive, it can upset that plantar fascia. So it can affect athletes. It can affect pretty much throughout the whole entire, from young kids to older adults.
Perfect. Okay, so are there different types of it, or how does it work in that way?
I would say it's all pretty much the same. It just depends on what causes it. Sometimes it can be an overuse injury. Let's say, especially common as weather warms up. Let's say you haven't been running and then you decide, I'm going to go for a run, and you haven't run in a long time. If you have one of the risk factors, or even if you just haven't used it in a long time, that fascia isn't used to that load. Let's say you go out and run 4 miles, the fascia is like, whoa, I'm not used to this load. And then it gets irritated and inflamed. And then you get that pain in the bottom of your foot. And sometimes it heals up pretty quickly, but sometimes it takes a bit longer.
Great, perfect. And then, so what would be some of the symptoms that people would experience to know that if they have it or not?
Yeah, so the main symptom with plantar fasciitis is when you get out of the bed in the morning, you take that first step on that foot, you're going to have pain. And after that, it's mostly pain with weight bearing, especially if you're going barefoot. So those would be the main symptoms of plantar fasciitis.
And it tends to either be in the arch or like right on the heel.
Mm-hmm.
Okay. Yeah, that makes sense more in the summer months then, because people go barefoot and then start experiencing other things with their feet that they haven't before.
Definitely.
Yes. So what are some of the causes, like we just touched on, maybe in the summer, or some other things that would make people experience this?
One of the main causes can be tightness in the calves. When your calf muscle is tight and you're walking, if that's tight, then the plantar fascia kind of takes more tension because the calf is tight. And so if you have decreased ankle mobility, whether that's the ankle is stiff or the calf is tight, that can put stress on it. And then depending on your type of foot, if you are flat-footed or you over-pronate, so if this is a foot and then your foot rotates in more, that puts a lot of stress on the fascia. But then in the other way too, if you have really high arches and you don't have arch support under them, then going from that high arch to flattening your foot can also overstretch it and put a lot of tension on it. Do you have anything to add?
Yeah, also like improper shoe fit, which kind of goes along with that. If you don't have that good support, then it can irritate that plantar fascia.
Yeah, perfect. That explains it perfectly. So then I guess since the symptoms and causes, when would be a good time to go see a physical therapist for it?
Yeah, so with this, the sooner the better. The sooner we get you rolling out the bottom of your foot, working on that calf mobility, on that ankle mobility, the quicker you're going to get over this plantar fasciitis episode. So sooner the better with that one.
Yeah, that definitely makes sense. Like with most things, I'm sure. So then once you're seeing a physical therapist, what exactly, I know it's different for everybody, but what exactly is the course of treatment for just a typical patient with it?
Depending how acute the injury is, let's say it just happened and you were really good and you came in the next day. First, we're going to have you rest in ice and take some weight off of it and just let the inflammation calm down. But then let's say you wait a little bit longer. Sometimes, and let's say it's a long-standing injury, sometimes you kind of have to recreate the inflammation process and get things rolling. But if it's an acute thing, we have you ice and rest and get rid of that inflammation. Have you start stretching your calf right away. We look at your shoe wear. We look at the shape of your foot, the anatomy of your foot. Do you need inserts? Do you need a more supportive shoe? And then we look at
Like we'll look at how the person's walking.
Yeah.
Say they have some hip weakness, which is causing them to pronate more. Then we'll fix that hip weakness. We'll fix that foot pattern, and therefore decrease that weight or that tension on the plantar fascia. So we'll look at the whole person and see why they're getting this injury.
Yeah, which I guess is why it kind of depends on each person for the course of treatment. So then that kind of leads into how can people prevent from this even happening in the first place as well?
Yeah, so you can do a lot of just like, if you know you're going to go on a big hike or you're increasing your activity level, maybe start off stretching your calves before and after you're done, rolling out the bottom of your foot with a tennis ball or a golf ball if you're worried about having this issue. And then also along with that goes with, so say it's summertime, you want to get out again, slowly increase your exercise. Don't go, okay, it's the first nice day, I'm going to go for a 15-mile hike. You got to slowly build up to those things, and that will help prevent it.
And then having good shoe wear, having supportive shoes, not going on a hike in flip-flops or sandals or something like that, especially if your feet aren't used to that load. So
Yeah, that makes a lot of sense. That's so helpful too. That about wraps it up on my end, unless you guys have anything else you want to add for the people watching.
Having some foot pain, or you think you have some plantar fascia issues, you can call the clinic here at 307-733-5577. And thanks for watching.
Yeah, thanks so much for watching. Have a great day. Bye.